Hi everybody, and welcome to my talk on preserving health and aging well. Today we're going to talk about what those things mean and our strategy that we like to adopt here at Naples Concierge Healthcare. I'm Dr. Jonathan Marsh. I'm a concierge doctor in Naples, Florida. I treat general internal medicine issues with a special focus on complicated patients and healthy aging. So we're going to talk about preserving health and aging well, and we're going to dive in a little bit deeper on what we mean by that. So first, we're going to talk about what is aging well. What exactly do we mean by that? We're going to talk about a issue related to that, which some people have called the 4 horsemen of aging. We're going to talk about metabolic disease, ASCVD, cancer, dementia, and then we'll touch on some preventative measures that we want to consider, some numbers around those, and give you some really objective information so that you know how important those are, and touch on a little bit of advanced disease prevention. We're not really getting into a lot of depth with the advanced disease prevention. We'll talk about that later. So when we talk about aging well, what do we mean? So to me, aging well means that I'm healthy, I live a long time, and that I don't develop any diseases. So it's not a matter of having a problem and then treating it. Although obviously you can do that and sometimes you have to, but that's not our first choice. Our first choice would be to not get sick in the first place. When we wait for diseases to develop and then we treat them, sometimes we end up with what's been called the lost decade or a marginal decade. So this is the idea that at the end of your life, in your 80s or your 90s, you may have a number of years where you're doing a lot of medical treatment, but you're not enjoying the things that you like to do anymore. So for example, traveling. And we want to not only get to that age, but we want to get there vital with a lot of our function left over. And we want to be doing the things that we enjoy and love. So one approach that we like to use here is to set a goal and work our way backwards. So an example that I use would be to say, okay, if when I'm 90, want to be able to travel, that means I have to be able to navigate an airport. I have to be able to lift 15 pounds over my head. I have to be able to walk a mile or two. So we know that at 90, we are unfortunately not going to be as healthy as we are at 40. So how do I need to look at 40 to have a goal of being there when I'm 90? And setting those objective goals can help really bring into focus where we need to be today. So the most basic thing that we need to do is to try and avoid getting sick. So one way to think about this, one framework, is to think of them as the most likely things to get you sick and knock you off your track of having that older age that's very healthy and vital. There's 4 disease states that account for 80% of the mortality in non-smokers over age 50. So if we can have a strategy for each of those 4 issues and avoiding them and being really aggressive with those, we think that'll give us our best chance of getting to our older age healthy and vital. The 4 diseases that contribute such a disproportionate amount to issues as we age are metabolic dysfunction, which we'll talk about in depth in a minute, ASCVD, cancer, and dementia. So we have some definitions here. Metabolic dysfunction is any sort of insulin resistance and being overweight. ASCVD is any intravascular disease. So mainly you're talking about heart attacks and stroke. Cancer is obviously cancer. We'll talk about that a little bit in the most common ones. And dementia, mainly we're talking about Alzheimer's because we've already included the other leading cause of dementia, which is microvascular disease or mini strokes in ASCVD. So dementia will focus on Alzheimer's. So let's start with metabolic disease. I'm going to use the definition here of metabolic syndrome. And you can think of metabolic syndrome as sort of a late manifestation of metabolic disease, which occurs much earlier. And I'll talk about that in a second. So metabolic syndrome, which is what a lot of objective studies have used as their inclusion and exclusion criteria, is central obesity, which you could say is a waist circumference of 36 inches, or another metric you might use is over half your height, insulin resistance, high blood pressure, and then dyslipidemia, which is usually high triglycerides and low HDL. So when we say metabolic syndrome, we're looking for all of these to be present in someone at the same time. So metabolic syndrome affects 30% of the US population. So those are really eye-opening numbers. 1 in 3 people at some point in their life is going to have actual metabolic syndrome, not just early insulin resistance. And metabolic syndrome is a contributing factor not only for heart attacks and stroke and diabetes, which you might expect, but also dementia, cancer, fatty liver, and then other diseases that affect your quality of life, like sleep apnea. So there's a lot going on in this slide. So metabolic syndrome. What's a framework we can use to understand metabolic syndrome, and that ties it into insulin resistance and the cholesterol issues that we talked about earlier. So metabolic syndrome is mainly a disease of overnutrition. So what happens is that when you're taking in calories, so excess calories, your body sees those, and the first thing it does is it stores it in your muscles and your liver as glycogen. And that's energy that's readily available. If you go into a nutritional deficit, your body can tap that glycogen. And if you go into a nutrition excess, it can store some more glycogen. And that's supposed to be what your body is using most of the time. Unfortunately, for most of us, that's not what's happening. Most of us are topped off on our glycogen, walking around most days, and then we're taking in extra calories even on top of that. And then what our body says is, okay, I'm not only going to store this as glycogen, which is easy to get to and break down and move in and out of our body, but I'm going to store some of it as fat. And when your body starts storing fat, part of the mechanism for how that happens is cholesterol moving through your body, and your body starts storing fat, which is a little bit of a harder energy source to tap into. So your body does this by secreting insulin. So it sees a bunch of calories and says, okay, insulin, take this energy, store it as glycogen, and now store it as fat. And what happens is that you start storing that energy as fat, more fat, and your body starts making more and more insulin, and your fat says, we're full, we can't take any more. But your body is still getting extra calories, so it keeps storing and storing and storing. And eventually your fat starts saying, I'm not going to take in this extra energy. And now you're developing insulin resistance. And that's the underlying process, is that your fat is requiring more and more insulin to get the energy from your bloodstream into your fat stores. And eventually that whole mechanism breaks down, and no matter how much insulin you give, your blood glucose levels are not normal, and that is diabetes. So that's when you start seeing prediabetes and diabetes. And the point I really want to make with this is, one, that it's mainly a disease of nutrition and exercise, which is how you burn energy. And two, that by the time you start seeing your average sugar go up, your average glucose go up, and things that your doctor is checking, like your hemoglobin A1C, you've already been insulin resistant for a while. You've already been overnourished for a long period of time before we start seeing that. So what are some tests that your doctor might look at, or you might want to look at? One is your A1C, which is your average glucose over time. You can actually measure your insulin level, which happens before your A1C goes up, but it's a little bit more of a labile test. You can do your waist circumference. So again, 36 inches, or if you're a little bit shorter, maybe half your body height as a more aggressive metric. You can actually get your visceral fat measured. So the visceral fat that goes around, that's fat that goes around your organs as opposed to the fat that is on top of your muscle, is a higher risk for insulin resistance. And you can actually measure that directly with the DEXA scan. And then your cholesterol panels, so your triglycerides, your HDL, your bad cholesterol. And then we can even check advanced lipid panels that can give us a better idea of what your cardiac risk is from your poor cholesterol. So with metabolic syndrome, let's put some numbers on what can happen. So obesity is obviously part of metabolic syndrome. 4.7% of cancers are attributable to obesity. So cancer feels like something that strikes out of the blue. You can actually reduce your cancer risk by maintaining a healthy body weight. The overall heart attack risk for everyone is 28% of that is attributable to obesity. And then of your stroke risk, this is a pretty wide number, but 22 to 64% of the stroke risk is attributable to obesity. So by maintaining a healthy weight, we can really decrease our odds of having cancer, heart attacks, and strokes. And we'll talk about this a little bit more at the end. So next we're going to talk about ASCVD. So ASCVD is heart attacks or strokes. So it means atherosclerotic cardiovascular disease. So anything that involves cholesterol building up in the walls of your blood vessels is ASCVD. And one of the main things to understand about ASCVD is that it doesn't start the day you have the heart attack. It starts in your 20s and your 30s, and cholesterol is getting into your vascular walls, and it's causing inflammation, and it's sitting there and it's growing over time until finally it gets big enough to obstruct the vessel. We like to think of this in terms of plaque. Cholesterol is floating around in your bloodstream, every once in a while, it can penetrate into the wall of your blood vessel. And when that happens, it creates inflammation. And so that means that if your cholesterol is higher or higher risk, then you're by default going to be at a higher risk for having these lesions in your blood vessels. So here are some pictures to just sort of show it. So here we are, normal artery, and now cholesterol is building up, and a little cap forms on top of this, and it's safe until finally, eventually, something happens, and that cap on top of it's called a atheroma. The top of that little cholesterol breaks away, and it creates somewhere where a blood clot can form, and then that's the sudden heart attack. But like I said, this has been going on for 20 or 30 years before you actually have the vessel rupture and the heart attack. 80% of people will have some sort of consequence of ASCVD. So that means heart attack or stroke. It does also mean hypertension, which maybe inflates this number a little bit, but 80% is a huge number. So avoiding this disease is really important. And not only could you have a heart attack and get a stent and be doing great, you could also get a stroke and have dementia and have debility for that reason. You could have a heart attack and fall into congestive heart failure and have debility for that reason. So it's not only that this can cause you to pass away, which is obviously bad, but also sometimes it doesn't do that. It causes disability and creates, this situation we're talking about avoiding and being chronically disabled for a number of years. And when we wait for the heart attack or the stroke to happen before we start treatment or before we take this seriously, that's sort of the road that we're on. So next we're going to talk about cancer. So cancer is very scary. We all have stories. We all know people, they were healthy, they took care of themselves, but they still got cancer, and it feels like it strikes out of the blue. And that's one of the things that makes it so scary. But there are some things we can think about when we talk about cancer for prevention. So first of all, just so we're all on the same page and we understand, cancer is when a group of cells in your body starts growing and then starts growing out of control. So this has to do with, one, the mutations that happen in the DNA that cause those cells to grow out of control. So some people are born with mutations that make them more prone to cancer, but a lot of times those mutations are acquired by being out in the sun, which is something that can damage DNA, or eating foods that are carcinogenic. But the other thing is that if you are in a chronic inflammatory state, that's going to encourage cells to grow and split. So some of it is under our control. One of the scary things about cancer is that it doesn't peak in your 80s and 90s like maybe dementia does. The peak decade for cancer is actually your 60s, which nowadays is pretty young, and a lot of us are still really healthy in our 60s, and it's really scary because it affects healthy people. So the most common cancers for deaths are lung cancer, colon and rectum cancer, liver, stomach, and breast cancer. And what I'd like to draw attention to is that some of these have screenings that we do, but some of the others don't. So stomach cancer, there's no set screening protocol for stomach cancer or liver cancer. Breast cancer, obviously we do mammograms now. Lung cancer, if you are felt to be a high risk because you have a history of smoking, they do screening. But right now, if you don't have that smoking history or you don't tell your doctor about that smoking history, you might not get that screening. So risk factors for cancer, obviously tobacco use. So not only for lung cancer, but all cancers, tobacco is pro-inflammatory. It is, a major risk factor for cancer. 40% of people in their life will have some sort of cancer diagnosis. Now that may be more of an indolent cancer, like a prostate cancer, but it's still not something that you want. So there's regular screenings that are recommended, colonoscopies, screening with your PSA for prostate cancer. But there are some newer technologies to try and catch even more rare cancers and catch things earlier on, mainly Galleri-Drale testing, which is a DNA test, and whole body imaging. And these are not recommended by the Preventative Task Force yet, but they are things that a lot of doctors are doing to try and completely minimize the risk of cancer. So next, let's talk about dementia. So dementia affects 4% of people over age 65, but if it's over 85, then you're talking about 13.1%. So it is a major cause of disease in people. And it's definitely something that puts people in the situation we were talking about before, of having that marginal decade where, we're alive, but we're really not able to do what we want to do anymore. And in some cases, we're even maybe institutionalized. So we've all known people with dementia, and it's very scary. Most dementia is Alzheimer's disease, especially since we already sort of put stroke in that other risk factor, in that other category. But there's also Parkinson's, Lewy body disease, other things that can contribute to this. So let's talk about Alzheimer's though. So Alzheimer's is the buildup of two different types of proteins in your brain, basically. There's beta amyloid protein and there's tau protein. Tau builds up inside nerve cells and amyloid builds up outside of nerve cells. There's different types of amyloid. This is beta amyloid, but there's also amyloid associated with the amyloid heart disease and some other conditions. But ultimately, these prevent the neurons from working, unfortunately. So I mentioned this a second ago. There's other types of dementia. A lot of these are still associated with the buildup of proteins in the brain, though. 15 years ago, they said that Alzheimer's, the only way to make a definitive diagnosis was with a brain biopsy, which nobody does. But there's been a lot of advance in this field recently, which is really encouraging. So now, generally speaking, they'll do a PET scan if you're concerned about a diagnosis of dementia, which can help get that diagnosis verified. There's also just now this year come out two blood tests, phosphorylated tau and beta amyloid 4022, that can give people an early idea of if they're at risk for Alzheimer's or not. And then there's DNA testing. There's a specific DNA group called ApoE. And if you're ApoE4, you're much more likely to develop dementia, which a lot of people are opting into getting done these days. So obviously the consequences of dementia, poor quality of life, you can live on for quite a while if you're otherwise healthy, being dependent on others, loss of dignity, frailty. I think we've all known people with dementia and it doesn't look good. So we talked about the four main diseases, sort of defined them, talked a little bit about their risk and what they are. So what can we do to avoid them? I think that we all enjoy talking about and thinking about supplements and longevity medications and all these things. This lecture, though, is more about the basics and what do we need to do, what is proven to help reduce the risk. And there are some medications, but maintaining a healthy weight and being active are the two main things. And we're going to go through some numbers to get an idea of just the scope of how important this is. So ASCVD, we talked about. So let's talk about diet and exercise in those, though. For every 5-unit increase in your BMI, so we're familiar with our BMI, which is a measurement that is our height relative to our weight. So for every 5-unit increase in your BMI, your risk of cardiovascular mortality goes up by 50%. That's a huge number. That means that maintaining a healthy weight versus being 20 or 30 pounds overweight means your mortality is going to be like 50% less. Another thing with diet and exercise is that if you are able to maintain a VO2 max, which is a measure of your cardiovascular fitness, you will on average live 5 years longer than someone with a lower VO2 max. To talk about just moderate activity, if you just do moderate activity, you don't have to be out there being the 95th percentile, but that alone reduces your overall risk of mortality by 27% at any given age. So that's a huge number. And people who describe their lifestyle as inactive, which I guess you probably have to be pretty inactive to describe your lifestyles that way, but those people have a double risk of ASCVD versus someone who describes their lifestyle as active. So just getting out there and moving and maintaining a healthy weight does a lot to decrease your risk of strokes and heart attacks. So let's talk about it with cancer. So again, that 5 units of BMI decreases or increases, depending on how you want to look at it, 19% you're at risk of cancer mortality. So cancer seems like it strikes out of the blue, but you can reduce your cancer mortality by 19% by maintaining that healthy weight. And the closer you are to that 25 BMI, the better. So this is specific to pancreatic, esophageal, and gallbladder cancer, which are some really, nasty cancers you get of the GI tract. And then the other point we want to make is that exercise, even if your weight doesn't change and you exercise, your risk of cancer decreases. They've looked at that specifically at bowel and breast cancer, but I would guess that generalizes to all types of cancer. Dementia. So dementia, again, may seem like it strikes out of the blue, but some people say it's diabetes type 3. It's from the chronically high sugars and the inactivity. So obesity increases your risk of dementia by 30%. Now, that's not Alzheimer's specifically. That's all dementia, but that's still a huge number. Regular exercise in middle age can decrease your risk of developing dementia by 20%. And even in old age, they did testing where they did these measures of mental function. They measured the hippocampal volume, which is the part of your brain that makes memories. And they showed that aerobic exercise, even if started in old age, improved hippocampal function. And I believe the intervention on this study was only like 3 months. So it's never too late. Even if you're already 70 or 80, getting out and getting some aerobic exercise helps preserve your memory and your brain function. So let's talk about exercise and nutrition versus medications though. Obviously you can do both, and we would say for anybody you need to sit down and make a assessment for them. But diet and exercise is as important as being on medication. So regular exercise reduces all-cause mortality by 25 to 30%. Maintaining a healthy weight, if you every unit of BMI of 5 you go up, your overall mortality goes up by 11%. So therefore, if you're overweight, every unit of 5 of BMI you go down, you improve by the inverse of 11%. So those are big time numbers. So treating your blood pressure, which is a lifelong being on medications, doctor's visits, the risk factors that go along with medications, the side effects. If you keep your blood pressure at goal with treatment, that reduces your cardiac risk by around 22%. I don't know about you, but I'd rather do just a little bit of regular exercise to get that cardiac risk reduction, rather than be on a medicine and risk those side effects for, decades. And then cholesterol control. So when the statins came out and we were first able to treat cholesterol, they were considered a miracle drug. They improve your mortality by 20 to 40%, which are huge numbers. But again, exercise and nutrition, this one's 25 to 30%. This is 11%, just as effective, if not more effective than keeping your cholesterol under control. So one thing that I talk to people about is it's easy to say diet and exercise. It seems common sense. But how are you actually going to get to where you need to be with these? So I like to advocate for objectively measuring and tracking these. If you were running a business or doing a project and trying to get something done, you don't just walk in every day and say, all right, work harder. Okay, great, I'm out of here. No, you set down metrics, you set down ways to track your progress to make sure that you're getting to where you want to be. And that's what you want to do with your diet and exercise. So there's a number of things that you can think about. Some of these can be done at home easily. Some of these you might get a doctor involved if you're really sort of struggling with the home measures. But you should be weighing yourself every day. From that, you can check your BMI. You can measure your waist circumference. You can do all of that at home. To come down to exercise, you can measure your VO2 max. You can also do, use your trackable device like your Apple Watch to get an estimate of your VO2 max. You can also just track your mile time, your 2 mile time. How fast are you able to run, or whatever your exercise is? How many watts can you do on the bike? Those all are objective measures that you can track and set goals for over your life. Now, if you want to get the doctors involved, we can measure your body composition on a DEXA scan. We can do a formal measurement of your VO2 max. Sometimes the apps and the quick and dirty ways of doing it, they are quick and dirty, so they don't give you as good a measure. Strength measures, so hand grip strength is correlated with mortality. It's sort of a stand-in for overall body strength. We've worked with physical therapists and trainers in the area who have sort of a list of strength metrics to try and track if you want to work with them. But the benefits of measurement are that what's measured gets changed. And, occasionally you've been working out and you're gaining weight and it's like, is it muscle or fat? I don't know. I feel like I'm getting healthier. So, objectively, how are you progressing on your aerobic work? And then maybe getting something like a DEXA scan at that point could help you really know where you're getting. I think most of us give ourselves the benefit of the doubt in our minds. So sometimes getting something objective can really, I gained 5 pounds, but I'm sure it's muscle. Probably not, but maybe measure it and see. If you're maintaining a healthy weight, and you are getting in your exercise, you may say, Dr. Marsh, that's not enough for me. I want to do everything I can. What is left on the table that I can do to make sure that I achieve this healthy aging and that I'm around for a long time and I have a good quality of life? Well, for each of these 4 issues, there are other things you can do. So for cancer, it's mainly the GRAIL and the whole body imaging, which we can talk about next time. For ASCVD, there are other metrics you can do to have an idea of how you were doing and what is your risk. So advanced labs, calcium score, there's something new called the Clearly score, periodic stress tests or cardiac PETs some people opt into depending on their family history. Metabolic disease, advanced labs play a big role in that. But then also if you're trying to improve your metabolic disease, your exercise tolerance, you want to be keeping a close eye on your hormones. Is your testosterone and your estrogen levels where they need to be to help you make the progress you need to? Make sure you're not suffering from a thyroid condition or something that's impeding your progress. Are you getting enough sleep? What are the other things that are contributing to your metabolic issues? And then, obviously we have new medications that are great for weight loss. They're not for everybody, but they do work really well and warrant a conversation, and is another reason to work with a doctor when you're trying to get to your healthiest. And then dementia. So advanced labs, like we talked about, the ability to measure now amyloid and tau, which didn't exist even a year ago, considering genetic testing, if that's something that you want to do. And then there's new medications coming out for dementia all the time, in particular Alzheimer's. So there's obviously a new one that came out, but there's a lot in the pipeline. There's giving those medications along with ultrasound therapy some people are experimenting with. So that's something you just want to be working with someone who is staying on top of it. So, a comprehensive roadmap to healthy aging would involve a heavy emphasis on maintaining a healthy weight and exercise, and depending on your specific circumstances, taking into account some of these more advanced treatments to help you have that roadmap. And that's something that we can help you with here. Thank you for watching the video. We appreciate you taking the time. We're going to have a talk on February 7th. We ended up not doing the January 14th talk. So we're going to be doing the optimizing the metabolic issues and what sort of medical problems might get in the way of that, and how a aggressive medical-based approach can help you achieve those goals better than just doing it at home on your own, but also give you a lot of knowledge around the advanced tests and what's involved with that. After that, we'll talk about dementia, and then in dates to be determined in March and April, we'll talk about coronary vascular disease and advanced cancer screening. So thank you for your time today. Thank you for watching the video. I hope you have a good day, and reach out to us if you have any questions. You can scan this. We're NaplesConciergeHealth.com, and reach out to us if you want to talk to us about our practice. Thanks.